What began in 1876 as a state charity hospital stands today as Louisiana's leading academic medical center. While young when compared to other institutions, LSU Health Sciences Center Shreveport has already made a significant impact on the state of Louisiana and surrounding region. In addition to caring for generations of Louisianians, the medical center has trained thousands of physicians, scientists, and allied health professionals in the healing arts. Each day, the center trains future investigators and provides accomplished researchers with a state-of-the-art setting for their groundbreaking work. During its history, LSU Hospital has undergone many transformations and name changes. From its original home in an abandoned log schoolhouse, it relocated in 1889, and again in 1953 to its present location. At that time, Shreveport Charity Hospital became Confederate Memorial, named for the construction funds that came from money originally set aside as pensions for widows of Confederate soldiers. A nursing dormitory was built a block away. The campus took on its current identity in 1999, when the legislature changed the name to LSU Health Sciences Center Shreveport. No matter the location or the name, the hospital has never lost sight of its original mission, caring for the state's most vulnerable individuals. In its early days, Shreveport Charity Hospital was a teaching hospital for interns and residents. Later, a nursing school was added and was open until the 1960s. This dual mission of patient care and training, integrated during the first century of the charity hospital, made it the logical choice to be the teaching hospital for a new medical school. In 1965, following a grassroots campaign mounted by area physicians, the Louisiana legislature authorized the LSU School of Medicine in Shreveport.
It took a long time and a lot of effort and legislative action and that sort of thing. But the local physicians, the Shreveport Medical Society, was very much in favor of it and expressed this in many ways, like trips to Baton Rouge and talking to legislators and things like that.
As soon as the legislature approved the new LSU School of Medicine, work to open it began. Leading the effort was Dr. Edgar Hull, whose reputation in New Orleans had already made him a Louisiana legend. Dr. Hull moved quickly, marshaling resources to get the school opened in record time.
We really attended most of the first full year without knowing for certain that the school was going to be accredited, but it was, and Dr. Hull said he never had any doubt.
The first class of 32 freshman medical students registered in 1969 at the nearby Overton Brooks VA Medical Center. 138 local physicians were recruited as gratis part-time faculty, joining the small full-time faculty Dr. Hull had already selected. In 1971, while the medical students immersed themselves in their studies, Dr. Hull and other dignitaries broke ground for the new medical school between the nursing dorm and Confederate Memorial. The event marked the start of construction on the 5-building, $31 million medical school complex. While the medical school was still under construction, Dr. Harrison and his classmates became the first graduates of the new LSU School of Medicine in May of 1973. Even before the 1975 ribbon cutting for the medical school complex, the nucleus of today's LSU Health Sciences Center Shreveport was in place. The LSU Medical Center in New Orleans expanded its schools of graduate studies and allied health professions to the developing Shreveport facility and retained oversight of the Shreveport campus until 2005. In 1976, as Confederate Memorial served thousands of adults and children across northwest Louisiana, the visionary leadership of Dr. Allen Copping, Chancellor of the LSU Medical Center, redefined its role. He persuaded the state legislature to transfer Confederate Memorial from the state charity hospital system to the School of Medicine in Shreveport. Later that year, Confederate Memorial began its second century as Louisiana's first university teaching hospital. As the 20th century ended, the campus moved forward under a new name, LSU Health Sciences Center Shreveport. The new century also brought new leadership. Longtime Department of Surgery head John McDonald was named as the Dean of the Medical School and first Shreveport Chancellor. He led the institution during a period of tremendous growth in the campus's physical plant, including the opening of the Women's and Children's Center, the construction of the Ambulatory Care Center, the Feist-Weiler Cancer Center, and the School of Allied Health Professions building. The busy university teaching hospital continued to be a leading provider of innovative healthcare services. Dr. McDonald brought kidney, liver, and heart transplantation to the region in the late 1970s and early 1980s. Additionally, a Level 1 trauma center, a regional burn center, neurosurgery, and centers of excellence for rheumatology and cancer make LSU HSCS a referral center for the entire Arklatex. Each year, our medical and support staff care for tens of thousands of patients, including 21,000 inpatient admissions and 450,000 outpatient visits. Our Cancer Center faculty and staff conduct important clinical research, in addition to providing world-class treatment for cancer patients of all ages. Through a partnership with St. Jude Children's Research Hospital, children can now stay close to home while being treated for cancer and catastrophic illness. Under Dr. McDonald, the state transferred hospitals in Monroe and Pineville to the Health Sciences Center, improving health care all across North Louisiana. E.A. Conway in Monroe and Huey P. Long in Pineville together record more than 10,000 inpatient admissions and about 230,000 clinic visits annually. Today, under the leadership of Chancellor Dr. Robert Barish, the LSU Health Sciences Center Shreveport is comprised of 3 major campuses, operating 53 buildings and over 2.8 million square feet of space. Some 500 residents and fellows are trained in 38 accredited programs. Over 400 medical students are enrolled each year, and more than 100 new physicians are graduated annually. And nearly 400 students study for a bachelor's, master's, or PhD in the allied health and graduate schools. Faculty across a number of different areas expand biomedical knowledge through research leading to advances as diverse as Louisiana's first organized tumor clinic, development of the first FDA-approved antidote for antifreeze poisoning, development of a sophisticated cement-free artificial hip joint, and one of the nation's first successful in-the-womb treatments for a life-threatening fetal lung cyst without surgery. These breakthroughs are a testament to LSU Health Sciences Center Shreveport's academic rigor and reputation, making admission to our medical, graduate, and allied health schools increasingly competitive. As of May 2009, the Health Sciences Center had graduated almost 3,200 new physicians. Over 5,300 physicians had completed their residency programs. More than 360 scientists received master or doctoral degrees, and more than 2,100 physical therapists, physician assistants, occupational therapists, and other allied health professionals had graduated as well. These professionals are now impacting the public health of communities in Louisiana, Texas, Arkansas, and across the nation. In addition to its role as an academic health sciences center, LSU HSC Shreveport is a major economic engine as well. Each year, the Health Sciences Center helps create approximately $700 million in economic development in the local economy. With more than 5,500 employees, the Health Sciences Center is the 4th largest employer in the area and the largest in Shreveport. At the same time, faculty researchers are winning federal research grants, which channel tens of millions of new dollars into our local economy.
Hello, I'm Dr. Robert Barish, the Chancellor of the LSU Health Sciences Center in Shreveport. For well over a century, the Health Sciences Center team has been delivering state-of-the-art patient care for residents of Northwest Louisiana and beyond. In addition to helping families and their communities, our dedicated faculty and staff are training future generations of doctors, allied health professionals, and researchers. By giving these future caregivers the tools they need, we are making Louisiana an even healthier place to live and work. By empowering these future scientists, we are affecting medical discoveries and advancing biomedical knowledge for generations to come.
The LSU Health Sciences Center is more than an academic training center, more than a teaching hospital. It's an industry whose caregivers, educators, and researchers touch the lives of thousands of people across Louisiana and beyond.
What are our duties as a health sciences center? We aspire to train the best physicians and paramedical people there are. Not just that the best there are around here, but the best there are anywhere. We aspire to make major contributions to medical knowledge through our research. We aspire to bring frontier medical advantages to our community. And our community is not only Shreveport, it's not only the state of Louisiana, but it includes the world at large.
Our history spans more than 130 years, a history that has seen us grow from humble beginnings to become a leader in patient care, education, and research. At LSU Health Sciences Center Shreveport, we're proud of our past, but we're focused on our future.